So maybe the improvements will be same like what you got before previous treatment.
Yeah.
Very similar improvements. But we can make sure you get improvements in your legs. But then again your hands are weaker, so maybe not very useful improvements really. Of course you will be able to move your legs again, you will be able to stand up, but it will be a struggle.
Yeah, but I already stand up. I make that already.
You can, of course, you can see visible improvements. Visible difference is much better than you can able to lock your knees. You can able to take steps.
Yeah, but only with electricity.
Yes.
Yeah.
Only with electricity. Yes.
Yeah. So yeah, for me it's a bit normal.
So maybe it will not make a huge difference in your life if you don't have good hand function.
Yeah.
So maybe I would say that's why I recommended the surgery first and then go for the electricity for your legs.
Okay. And this one is 50,000 francs.
Yeah. And of course with this one also we have limited experience, right? We have to wait. But for lower levels we are sure it works. It works very well. For neck we just need a little bit more time to see.
Yeah. And it's a little bit. Yeah, you said it's not so much risky, or you don't know.
Well,
you don't know because you have only one to make a surgery.
Well, we treated 6 patients with this surgery. The location is different, right?
Yeah, but in the neck you said you only
neck,
one.
2 possible complications. One is the infection of your spinal cord or your brain, because if there is contamination, or the infection of your wound. The second is the respiratory weakness. So we treated 1 patient, we didn't see any complication. The neurosurgeon, he's extremely experienced. He can perform very small surgeries. And see, this is a big hospital, so with the operation room, all the staff, everyone is very experienced. We have good machines and everything, good support. So the risk is very, very low.
And here you have machine for tracheotomy here.
Yeah, of course. Yeah.
You have everything. Yeah.
Emergency tracheostomy, mechanical ventilation, everything.
And how many people work when I have the surgery? How many people? I said doctor and.
In this floor, in this hospital?
No, just when I make the surgery as a team.
It will be the neurosurgeon.
Yeah.
It will be anesthesiologist.
Yeah.
And it could be two main doctors. Maybe 2 anesthesiologists, depending upon your anesthesia. It's 2 doctors.
And the surgery.
In total, 10 persons in total.
And the surgery work for
4 hours.
Okay.
1 surgery for 4 hours.
4 hours.
4 hours.
4 hours in the back and in the back.
If it is together 2 surgeries, maybe it will take 5 to 6 hours for both surgeries.
Okay. And only the back.
Only back is also 4 hours.
Okay. Yeah, it's okay.
The same, basically, is very similar kind of surgery.
Yeah, but it's 2 different surgery, or it's 2 different neurochirurgian, or it's only one? Same to work in the up and down.
Yeah.
Okay. So yeah, I see.
Okay.
And what's happened when we pay the treatment? It's before, or it's?
We have to get before, because we have to prepare for the stem cells and everything.
Yeah, but you make the stem cell here, or you make the process for this? Because I see in your website you make different surgery, not about spinal cord. You do different stuff here. You didn't work only with spinal cord injury. You work.
No, we do other conditions.
We treat many patients with stem cells. Yeah. Not
multiple sclerosis, ataxia.
Yeah, and he had for everything.
For a lot of things, not for everything.
We treated about 20 conditions, like mostly neurological conditions.
Yeah.
Brain injury, spinal cord injury, and stroke.
Okay. So your spinal cord is inside the hospital?
Yes, everything is inside the hospital.
Okay, so it's good.
Yeah. You don't have to leave. Basically, you will stay in the hospital. You will have to be in this room for 10 days for the next surgery, 2 weeks for the epidural surgery, and then you will move to another room upstairs. But you will come here on this floor for physio, and on 3rd floor also.
Okay.
But you will have to stay in the hospital for whole treatment.
Okay.
Everything is included in that standard.
But what's happened? You first have the surgery. You stay 2 or 3 days.
About 2 days of rest to make sure there is no infection, there is no complication. Then we start after epidural, the electricity. We start mapping.
Mapping, yeah.
for about
one.
For about 2 weeks, then we start more extensive training. Once you get more muscle contraction, enough to, let's say, stand up, then we start training.
And you go step by step.
Step by step.
It's good to
Step by step.
you know you have no infliction and to body recover.
Exactly.
Okay, it's interesting. And after 2 or 3 weeks, you are able to train normal. You see?
Well, it depends how much contraction you got, right? So
Yeah.
some patients is slow, some patients is quick, so very different.
Yeah, you adapt about the patient.
Exactly.
Yeah. And you see me, I have a really bad problem with the bladder because when I make a surgery and I have a narcose, after the narcose, my bladder it's tired, or I don't know how to explain, but I can pee normal, so I need to catheter because now I just make percussion, you know. I just percussion and the urine get out. But when I make the surgery with a narcose, after sometimes I feel bad and I need to have a catheter. So you make that here?
Is there a risk for? Do you understand this question?
No, actually.
Like after anesthesia, his bladder started to work less in the previous surgery he did. So he's asking if there is any risk, or if you know.
Well, this treatment, no risk. No, it will not
But it's
have
because
any
of the what do you call
It's a narcose.
necrosis.
Narcose, yeah.
Anesthesia.
Yes.
Necrosis.
My bladder it's
Bladder
sleep
necrosis,
after,
right?
yeah.
Yeah, but with this surgery, no risk of anymore. We may see good improvements in his bladder, honestly, after epidural, maybe after a few years, but with stem cell, maybe in a few months. But there is no risk of any more damage to your bladder.
Yeah, but it's not a problem about the surgery.
Yeah,
It's
it's
just
about
about
the
the,
anesthesia.
Anesthesia, yeah.
yeah. Because last time I make a surgery in February last year, and
For
I
what?
Do you know the specific type of anesthesia?
yeah, I can ask.
Yeah, we can check if you. I mean, if you had a reaction, then
Yeah.
yes. But I don't think it could be anesthesia.
Because it was a small operation and just to take off some cable, it was 1 hour. But after I feel so bad because my bladder doesn't work with because I was
But then it came back,
anesthesia.
right?
But
Yeah.
anesthesia maybe cannot
He
really.
thinks it's because of that, but we don't know.
Maybe it's
because I was still so slippery and my body was so tired, so my bladder don't work
maybe
so well.
there was more damage to the spinal cord. I don't think anesthesia can cause the damage to the spinal cord.
But not to the spinal cord. He means like I don't know. If
The
it's,
spinal
Just my
nerves
body
also.
was tired and my bladder was tired.
maybe
Maybe
it's
it
not.
was it was not directly anesthesia. Maybe something happened because of maybe low blood pressure as a result of anesthesia. Actually, I don't know, right? Because
Okay.
I don't have all the information.
Yeah.
But we can see because if you have some reaction to anesthesia, it is normally very severe reaction. So it should be if you have reaction with anesthesia, then it should be all of your functions which should be affected. Not only the bladder.
Yeah.
Because then you have it affects your speech and swallowing, your vision, your hand function, everything.
Yeah, but
So-
I have this
So
directly.
anesthesia cannot just specifically damage your bladder.
Yeah, but maybe it's all my body to be tired and especially my bladder, and it's why I
No,
can't
no,
work
I don't
like.
think so, because then you should have a problem in your hand also. Then everything should be weaker.
Okay, so yeah, I send the what products.
You wanted to know if you will have like chances to have more pain after the surgery. No?
How much is the pain after the surgery? About the cable and the neck? Because when I make the surgery in my stomach, I have really so much pain in the
Well,
stomach, but now it's more in the back.
For electricity, because
Yeah.
it's below your level of injury, you don't feel anything really. Because
Yeah.
you don't have very good sensory function, right?
Yeah, I feel a little bit, but
But and you don't feel anything. But if it is neck surgery, you may have nerve pain in your shoulders and in your arms. Sometimes it may require like morphine, like strong pain medications.
yeah.
But this takes few days, maybe take 1 week or 10 days to recover from the pain. Yeah.
Okay.
But with epidural, no risk.
Not so much. Okay.
And it's also because the stem cell injection will be a small needle, so maybe the needle can cause some inflammation in your spinal cord a little bit. So this may cause a little bit pain. Yeah, the epidural stimulation is not directly on the spinal cord; it's one layer above the spinal cord, so it's not penetrative.
Yeah.
You know, the stem cells are penetrative. They penetrate inside the spinal cord, so they may cause some inflammation and some pain.
Okay. Yeah. So I think.
But it's not nothing very bad. I mean, it could be bad really, but
Yeah.
you can always treat it with pain medications, and it's temporary.
But it's not chronic.
It's not chronic.
But maybe it's normal if I have more fire in my arm, in my legs, because of course we improve the nerves and the spinal cord in this level. So if I feel more, it's possible to have
That will
my.
be a different thing. So the nerve pain is immediately after the surgery for next few days. But if we want to see if your spinal cord is regenerating, then you may
It's
have
what?
a little bit more the regeneration of the spinal cord.
Regeneration.
Then you may feel your body is a little bit more spastic. You may have a little bit more spasms and more stiffness in your muscle. So that's a good sign because then your body is regenerating. You know. So when complete spinal cord injury goes to incomplete injury, in between there are some complications like some spasms, spasticity. So that's a good thing. But if it is just nerve pain, that means it's some inflammation only. It's not, we don't take it as a good sign. It's not a bad thing
Okay.
also. I mean, it's just expected side effect, really. This is not specific.
Okay.
Just about recovery.
Okay. Thank you. And which time is the best time to do the surgery for you?
It depends upon you. For
Yeah.
epidural stimulation, we may need maybe 1 month or 6 weeks of notification.
Yeah.
For this surgery, I would say 10 days notification is
Yeah.
enough.
Yeah, but I think it's end of the year or next year. I don't know. It's
It's
depend.
really up to you.
Yeah. Okay.
I mean, if you
But after I'm afraid because I have so much complication to come here with the airplane. You know, he lost my 2 wheelchair in Muscat. Yeah, and I said it's really important to have my wheelchair. And at first he sent the luggage we received yesterday, and today I received this wheelchair. But
And the shower one is not yet.
and I hope today I have the other wheelchair. But yeah, I see it's complicated to speak sometimes with
it's not easy.
Thailandese people.
It's not easy, yeah.
But-
So you have to inform Iker when you want to come, so we can prepare, right?
Yeah,
We just need.
because here you have everything. You have room for hospital.
Well, now yes, but next week, next month we may be full for epidural, for example, right?
Okay.
Because now it's just some holidays, so we didn't book patient for this week. Next week we have a lot of patients.
So, what's your plan with a patient? You would like to have more patients to train and to have more. Or what's your plan for this year? You have
Yeah,
how
but there's
many?
always a limit. We cannot treat 10 patients with epidural stimulation every month.
How much you
There's a
take?
limit.
We take only 4 patients now
4 patients for a month.
for 1 month for epidural. 4
Okay.
patients at a time.
Yeah.
Yeah. Because
Yeah, it's good like that. You can take time for.
because
for
it takes time because we have 5 therapists who can work with who can do mapping.
Yeah.
So we can only take 4 patients
Yeah.
because it's a lot of work basically.
Yeah, and it's a lot of work.
And for rehab center also and for the therapists.
So it's good because you said in a few weeks you have
We have 3 patients next.
three
first
patients
week
and
of
you
November.
make a surgery in the neck.
No, epidural,
Okay.
the electricity. But end of next month we
Yeah.
have 2 patients. Yeah.
You said me, okay.
Like one, yeah.
So maybe I can speak with you and
Yes, sure, please.
or what is better after a few weeks.
I think end of next month we will have first patient who will do 2 surgeries at the same time.
Okay.
Yeah. So the neck one and the electricity.
Yeah, so it's interesting.
Yeah.
And you think you are the first hospital in the world to make that to every customer and easily? You think you are the first hospital to?
For the epidural stimulation?
Yeah,
the
for
most-
everything. And
Well, we're not the first one, but we're the one, Dr. Hansen can say, we're one with the most number of patients. There's actually one in the States that does it as well, but they charge like $400,000 or $500,000, if I'm not mistaken. But it's a trial, they don't really do the proper therapy.
yeah,
So in the US there is a University of Kentucky.
Kentucky, yeah, with
They do basically they started the original research, but first of all, not everyone can go because there are few thousand patients applied.
Yeah,
They take only 1 patient out of 1,000 because they take the best one. Then also it's very expensive because you have to maybe have 500,000 baht. Oh, sorry, $500,000 to get into the trial and they take so long time. They are very slow.
yeah, it's Arkema.
Yes.
It's with Arkema, yeah, because
But-
I sent my paper maybe 3 or 4 years ago, and I have an insurance 2 years ago. Yeah, it's okay. you pass for the first exam, but at this time I have no more answer.
Yeah, yeah. Well, it's very difficult.
So
So we do the same. It's the same machine, same everything is same. But of course we are much more experienced because they are very very slow.
Yeah.
They do so many EMGs. They do a lot of research.
yeah.
So
why you are there in Thailand, because it's more easy to try and it's more easy to go forward.
The regulations is easier to do.
Yeah, exactly. Because in Europe and Switzerland, oh my God, it's so complicated for everything.
It's complicated, yeah.
So sometimes we lost so many time about that.
In China, in Thailand, in Japan, Korea, it's easy.
Yeah. But I think it's good because if you have a result and if it's everything okay.
Yeah. So you don't have to go to Europe. It's very
Yeah.
difficult.
Yeah, see, and it's so expensive because you need to speak
And
with
the
the countries.
regulations are just very different. They
Yeah.
take so long time to basically approve new treatments.
Yeah. Okay.
Okay.
So perfect.
Okay. I have to go. Okay.
Absolutely. Well, thank you so much
Thank
for
you
your
very
time.
much.
Thank you.
Yeah, thank you so much for your time.
Okay. Thank you.
Thanks, doctor.
Okay.
So you wanted
Good day.
to take a shower, right?
Yeah, with pleasure because I don't take shower for 3 days and if I can.